Hey everybody! I thought you'd like to see the diamond painting I'm doing. This is a picture of it right here. This is the diamond painting that I am doing. Here are the measurements. But isn't this pretty? Let me come back a little. Look how pretty that is. And if you notice, on the horns, you have, here. Where's my finger at? Oh. If you notice, on the horns, you have winter, spring, summer, and fall. Is that how it goes? Or no? You have spring, summer, autumn, winter, right there. But this is from Diamond Art Club, and this is the date I started. It's called Seasons Change, and here's the artist right there. But these are all the colors that are in this diamond painting pack. See all these colors? There are actually 37 different colors, and how I know is this right here, these numbers right here. They're counting the numbers. These are the numbers that you recognize on the painting here, and these numbers here are how you label it, like this, so you know what to look for on your diamond painting. So I figured that maybe you guys would like to see what I'm doing. I have my mind is always a racing mind, and so I have to keep my mind busy. But isn't this a beautiful painting? It's got a little baby over here. So I'm going to show you. So it comes in this little pack here, and these are the diamonds right here. And so what you do, and it also comes in a little pin. And all you do right now, I'm going for the little dots. So you just match up whatever you need to match up and whatever you're looking for, and you just start putting the diamonds onto your canvas, and eventually you'll make this here. I'll try to see if I can get it at a different angle where you guys can see exactly what I'm doing. It's kind of hard, but I don't have any hair on today. See? And I don't know, I'm just hanging out and trying to feel better, trying to get my stomach from stop hurting. Yesterday was my last Red Devil. Woohoo! I really need to edit my video from yesterday, documenting all of that so that I can put it on as my journey. I'm not cancer free. I still have cancer inside my body, but it was my last actual chemo treatment. So the next thing that I have to do is I have to get with my surgeon now. I was supposed to have my appointment with my surgeon yesterday before I started my chemo and seen my oncologist and all that. But he had to cancel because he had emergency, I guess a family emergency. And so he had to cancel our appointment. But I have another appointment Tuesday with him. So my daughter-in-law and my husband are all go with me on that day. And we're going to discuss, lumpectomy versus mastectomy. And we're going to look at the MRI and see how far or advanced or how much of a remission the tumors are in my breast and how much infected are my lymph nodes. So, and then that will determine mastectomy versus lumpectomy. So when your little sticky thing here, let's see that in there? If it gets dry, see how there's nothing in it? It won't pick up the diamonds. So you get these little, it's like wax, and you just stick it in there and twist it around. Get you some wax inside your pen, and it helps pick up the diamonds easier so that you can put it on your canvas. But anyways, so as you guys heard the radiologist doctor say, that technology has come a very long way as far as mastectomy versus lumpectomy. And you know, they really try to avoid the mastectomy because it's a bigger surgery, longer recovery time, more painful when it's not necessary, when all you really need is a lumpectomy and radiation added. It comes up to the same reoccurrence percentage as a mastectomy with radiology or radiation. So, but, you know, if it was like 80% of the breast that was still infected, and a mastectomy would be the route to go. But if your tumor has cooperated and started to show some remission or started to show shrinkage from the chemotherapy treatment, then a lumpectomy would be what's recommended. So, I don't know. I'm just really super torn. I mean, if they're saying that it's going to be the same recurrence percentage from lumpectomy and mastectomy, then of course I'm going to do the less, you know, recovery time and the less pain, you know. But then in the back of my head, I'm like, well, I don't know. I've come this far. Should I just push for the mastectomy? If he says lumpectomy, I don't know. I'm so confused. That's why I'm not going to even think about it. I'm going to wait until to hear what he has to say and read the MRI, and we'll just go from there, really. I mean, he's a surgeon. He should know what's better. I mean, why would he lie to me? I'm sure because I'm his patient and he's the doctor. I mean, if his surgery doesn't go well, it looks bad on him. Or if his percentage guess isn't right, it looks bad on him. So I can't see why he would try to push something that, you know, he didn't believe would work. And now that's just me. I mean, maybe I'm wrong, but I feel like he's a pretty shoot from the hip, straight kind of doctor. He's not like one of those wish-washy doctors that just will tell you anything because they don't want to hurt your feelings. No, he doesn't care about your feelings. He cares about your health. So he's pretty straightforward and to the point, and he doesn't, you know, wish-wash around, flip-flop around. He's pretty to the point, and I trust what he says because he's that way. You know, I start to not trust a doctor when they're wish-washy. That's when I'm just like, my eyebrow raises and I'm like, oh, what's this doctor doing? What's he trying to sell me? When they're like that. But when they're, you know, very straightforward, don't sugarcoat anything, just tell me what it is, how do we fix it, and let's do that. And that's what he is. He's a pretty straightforward kind of doctor. So I like that about him. That's why I stuck with him. So, you got to kind of trust what your doctor says, especially when you know he's trying to do it on your best interest, and he shows up, he backs it up with proof, with data. Data can't lie. So, I don't know. I know, 15 years ago, the way to go was, the mastectomy. And I think they did mastectomies, but they didn't follow up with radiation. And that may be why those numbers came back where there was a reoccurrence of cancer, because they didn't follow up with radiation. But nowadays, their medical technology has really improved, and it does as time goes on. So, I don't know. We'll have to see what he says. I mean, I was sold at, let's do the mastectomy, but then listening to my radiologist and him kind of just taking the time out to break it down and say, what the medical things were, what mastectomy versus lumpectomy plus radiation, what the success rate in that is. It just kind of got me, it made sense. All of it makes sense. So now it's got me questioning myself again. I know, you guys, if you've never been in this position, it's a hard, very hard thing to decide, because, it's initially your health and you're trying to fight for your life, so you want to get on with your life. You're kind of, when you have cancer and you can't go anywhere because your doctor said, you can't be out, your immunity system is low, you can't go back to work because, you can't afford to get sick, and you work in a place where lots of people are sick and they still come to work. It's not recommended that you go to work because you have a low immunity system and you're trying to fight for your life already. That's all you need, is to get hospitalized and get an infection in your lungs or wherever, and now you're fighting that too. So, you can't go back to work, you can't go anywhere, you can't go to the movies, you can't. My sons were even home from they got leave from their base to come home and visit, and I couldn't even go anywhere with them. I mean, I'm glad they got to go places, and normally I would be right there with them, going bowling, shooting pool, going to the movies, going out and doing putt-putt golf and frisbee golf and, all the fun things that we usually do, going to the restaurants, eating dinner, eating lunch, eating breakfast. Mama couldn't do all that stuff this time, so kind of made me feel bad, but I have to do what's best for my health, and I have to keep remembering this is short term. This is very short term, and I will be able to get back with my life on track after I get rid of this cancer that's inside of me. Now, I also understand, because it is in my lymph nodes, the cancer is no longer contained into one area. It's now spread to the lymph nodes, which, your lymph nodes all filter together, and they're all throughout your body. You heard he said there's like 1,200 lymph nodes within a human person's body. It was either 1,200 or 12,000. I can't remember. I think 1,200. But, so, I mean, reoccurrence could be anywhere. It could be in my lungs. It could come back in my liver, my spleen, just anywhere that there's a lymph node. The reoccurrence can always happen. Even if I had a mastectomy or lumpectomy, whichever, it's not contained within my breast area. It is also in my lymph nodes and could have spread already. So that it's going to require a bunch more testing to make sure it doesn't. My body is cancer-free. And that's a full body scan, CAT scan, where they pump dye into your body and then they push your body through, and it's like a half an hour to 45-minute testing, which is very uncomfortable. But, you know, if you want to live, you got to do these things. But that's why I can't go to work. That's why I can't go out to many places. And I'll tell you, the only places I've been, hospital and home. That's it. And anybody that comes to visit. But it's less chances of being sick, just people visiting, than me out at a restaurant or out grocery shopping or out gallivanting around. So you just got to do what you got to do to survive, you know. But I've been on here for 15 minutes and I hope I didn't bore you all. But I will be editing and putting out the video, my last chemo treatment video. I will be editing that maybe tonight or tomorrow night and putting that out probably by Saturday or Sunday. So I apologize for it being a little bit late, but I don't know. I just need a break from that whole hospital scene, you know, and doing something that's going to keep my mind busy. So I decided to do this instead. But I might work on it tonight. Anyways, I love you all so much. Thank you for all the prayers. Thank you for all the love and all the encouragement. And I will see you on the next video. I hope you enjoyed this one. And maybe leave in the comments if you like watching me do the diamond painting and just talking. If you like that better than me just putting my big old mug on the camera and talking. Let me know in the comments what you think. Was this pretty cool to break it up like this? Anyways, love you all so much, and I will see you on the next video.